Hartstikke dankie. Ladies and gentlemen, for the ones who have questions, we have opened the mic.
Aha, General Molenaar. Daarachter, daarachter zijn de mics. Daar waar die...
Ja.
Ja. Oh, sorry. Telling you, they're teaching us how to whoop your... Yes, General.
Thank you so much for the invitation to be here. It's very nice. And a very warm welcome from you. And thank you for a very interesting presentation. I was very intrigued by your first part about connecting the dots, and that all the different health professionals and institutes have different diagrams. And that 7% has certified waste and 93% not. So my question is, what is your first step as inspectorate to connecting the dots in that landscape?
Thank you for your question. The first step is today. This is the reason, this is exactly the reason for the first step to organize this quality conference with this topic, to make you aware, to meet with each other, for you to have support from each other. And secondly, look, like Olga said too, we have collaboration with the Quality Institute, we have collaboration with AZV, and in there too you will be seeing that on national level we will start demanding certain things, because you see sometimes, you know, it's a human thing that if I don't really have to start, and like Chrissy said, they just wanted to be the best. That's why it's so beautiful to see that they didn't even have something to push them, they just started. But we have different variation of people. Some people that said, I want to be the best, and the others said, oh, I'm gonna wait until the rest. So that's all possible. So next step will be that on national level, just like the laboratories already have, they have a mandatory to their contract with the AZV, they have to have their accreditation in order. And more we're going to close in. It would take time. I mean, this is exceptional what Botica de Servicio did in 3 months. I mean, everybody that knows quality goes like, whoa, there's something big. But with time, we're going to make it more mandatory to have a quality system.
Thank you.
Thank you, General. Yeah? Priscilla.
Hi. You're smiling because you know already have some reason. That's very critical, I must say. I do see the importance of quality. I've always, as the ones that know me, strive for good quality. I must say in the last couple of years I've been trying to get the ones that can make the bridges between the islands, see the importance of making those bridges, and I haven't have positive reaction. And I must say also that I feel very negatively lately because my energy is getting low. And I hear you say we're gonna implement regulations and also check if these quality systems are in place. I must say I would like to also ask that you guys, AZV, the Minister of Gezondheid, and IVA, see what is necessary first to make the possibilities of having quality, so we can then also put in place quality systems. Because if I cannot have what I need to be able to give quality in different aspects of being a family physician, then I also don't feel to put a system in place that will maybe even more negatively show what is not good enough, instead of seeing first what is needed.
Thank you. Thank you for your marking questions. And that's why I really like Priscilla is one of the front fighters in quality, and I think the most of the procedures for the incident procedures between healthcare providers were initiated by Priscilla, and we really appreciated that a lot. And exactly what Priscilla describes, you can be already there, but somebody else isn't there, and it takes more time. There is a lot of resistance, and there's a lot of negativity and in hand pointing, and there is not a lot of focus. Oh, let's go and work together for the better. And that's why you see the emphasis, what we say, and even the SDG goal 17, that is the working together. And it's saying it is very easy, but doing it is something else. What I always commented, yesterday I commented to General Molenaar and to Colonel van Klink, is that what we do not have on the island, and I'm very aware of because I have lived 23 years in the Netherlands, being submerged and in the whole quality and safety geweld that we had there, is that what the government here did, in the Netherlands did, we do not have that on the island. They had 8 years long of a system of veiligheids, the VMS, the veiligheidsmanagement systems. So they created from the government, Jabet said, maybe in legislative parts they didn't do anything, but in quality part, the government in the Netherlands really pushed a lot. And you see that the trainings were given, education were given, so everybody was talking the same language. We had a conversation with the Inspectorate of the Netherlands the day before yesterday, and we said that too. They like, you have to pinpoint a basis oorzaak in a calamity report, and we said, our field does not even know what a basis oorzaak is because we didn't have that conversation yet. So what I find very challenging, Priscilla, is that we have to move forward, but with the wooden spoon and the wooden knife, we have to paddling along. So as Inspectorate also we are very conscious that we have to give training about methodologies. We have to give training because I cannot tell you that you have to do something and I clip your wings and I say fly. So that is the balance that we are trying to find, and that is what I really found very inspiring from Chrissy, her conversation. You know, that there will always be people to point at why I cannot begin. But if there are jewels, in the words of Olga, that think, you know, I'm going to start, and we already have them. We already have them. A JCI is incredible. You know, a HKZ is incredible. There's the doctor that said he has the NHG quality system. So we have jewels here already that even ondanks, I don't know that word in English, despite, thank you, despite my whole whatever surroundings, I will still start. And I do agree that as Inspectorate we have to continuously see how we can link in working together with the Kwaliteitsinstituut and with the ministry. What does the field need in education more? Because that was the question from Joaquim too. You can do your thing, but you need to be educated. And we lack in that bit on Aruba. You're totally right. Ha, Daniel. First the wife, then the husband.
Thank you for the wonderful presentation. I admire your approach on quality, about co-creation, because qualities have to start from within. I heard your answer for the next phase will be start demanding. I would like to ask if there's also room for stimulating quality by rewarding quality instead of starting the demanding first.
Yes, thank you, Daniel. That is, I would like to link on what Jabert said. He said certain things were the last resort, or not Jabert. So you will have to have some things in place. Most of you know, you have the pioneers and you have the laggers. There's about 20% where you will find pioneering off, already doing their stuff, and we see that. The 7% already took off, and more of that percentage already started with something. So the 93% is not zuiver to say they have nothing, because some of them already started. So let's say that 20% already started, and you always will have the laggers. So you will have to have an external impulse, an external incentive to get people doing certain things. But that is not our vision, that is not our philosophy. The inspectorate of Aruba, we really, the ones that work with us, you know that we are looking for partnerships, because we go for the same goal, only we have another role within that same goal, but we are still achieving the same goal. You still have your hands in the patients. I don't have my hands in patients anymore, but it's still the same goal for quality of care. So in that, and it's system thinking, that is our basic philosophy at the inspectorate. So we don't go and blaming the individual people. You have to, just like Dasha said, you know, if something doesn't work, you change the system and you continue to improve, and doing one mistake doesn't mean that you're bad. It's just that on that day, things happen, life happens. It's smooth sailing in rough seas. So I do agree with you. At the other hand, if just like the quality, the annual quality report, if you can see the feedback we had the last 6 years, there was not many people that really made an effort to self-reflect. So if you sometimes tik nan chan chan, and you know, and that's beautiful, because we have here a variety of professionals here, and as inspectorate we are the external maybe stick. But we don't want to use that stick. We want to partner up and have dialogues and talk about which system do you need and how you are going to get there. And that is what we were talking yesterday too with the inspectorate of the military healthcare. You know, it's just talking more than getting, oh, you should not do that. But in the end, it would have to be mandatory, because otherwise it's a free-for-all. Thank you, Danielle. More of my favorite people.
You're my favorite.
Lucy, Dr. Pasner.
Thank you very much, Rosa. All the speakers are very, but I cannot help but wondering if the asset they should be involved in quality. Why do I say this? Because first of all, who corrects them? I mean, you can tell a doctor or a pharmacy, you know, they're doing it wrong, or they can, you know, there's sanctions. But who corrects the ASAV? The ASAV decides we're not going to pay for something. And the other day I asked for a medication for a patient, and the patient couldn't get it because the ASAV decided they're not going to pay for it. So my question is, you as the inspector, do you think that the insurance company who is paying the bill should be involved in deciding, because on all the lists I saw, ASAV is the first one. Should they be deciding the quality of what we're doing, or should it be around the other way around? We decide what we need, and they have to pay the bill. That's my question.
Thank you, Dr. Pasner. If I can take you back to the development in the Netherlands with the insurance companies there. Again, I was with my nose in the butter, we said in good English. And what we saw there is that the quality drive in the Netherlands actually kicked off with the healthcare insurances. Because from 2004 you got Shell, DuPont, they made very big investigations, TPG Post. They all said, how can you better the petrochemical industry, the aviation industry, they all were asked to, how can you better the quality of care? Because before 1999, it was like, yeah, you're a patient in a hospital and you have to die. You know, and so the shift of the mentality, what we were talking about, and the government of the Netherlands was already putting a lot of things in place, like the VMS-programma, Veiligheidsmanagementsysteem. But it wasn't until the healthcare insurances, they said, because they made a balance between price and quality. And that was something new in the Netherlands, because I worked on the operating theater, and one of my extra jobs was to do the inventory of what the anesthetist wanted. And we went from cardio echo to name it. They went to a convention and they said, that's what I want. And the sky was no limit, there was no limitation. And then you saw that the doelmatigheid kicked in, and that is where the insurance policy said, no, you can have diamond hips for somebody that you can expect to die in 5 years. I mean, let's talk about quality, let's talk about real life. And you're giving a patient that's 95 years old a diamond hip for the next 5 years, and there is where you saw the shift in the balance between price and quality. Because whatever you do, even in my budget, at the end of my money, I still have a week left. You know, you cannot, that is your budget wherein you have to handle. So I do like the questions, and I don't know how the landscape will become in Aruba. In the Netherlands, they almost took over. Well, actually, they took over and they decided which kind of hip material you will be put on, which kind of operation you would get, which hospital would get a Da Vinci robot, yes or no. They decided it. And the Netherlands is very good for us because my mother is Dutch, so I know the Macambas. They all tend to go in the extreme. And with the .dbc, with a lot of things, with protocols and everything, writing, just like Dasha said, millions and millions of pages of books, and then you have a new balance. So we can learn from there what is the good part of having healthcare insurance as part of the landscape. And what I am a really fan of, and in the 21 years of my experience in quality and safety, is the bundle aanpak. The approach, the bundle approach. So it's not a single thing. It's not only the AZV, it's not only the inspectorate, it's not only Kwaliteitsinstituut. And if you do not have that bundle approach, you will not get as effectively and smoothly shift in quality of healthcare. So I think it's a very good question, and we do have to take care with everything and have that dialogue. But I'm very curious as to what the future will hold in that.
Talking about the Netherlands, as far as I know, the only company that made money in the Netherlands is the insurance company. Everyone else is like struggling. First of all. Second, you have more than one insurance company in the Netherlands. Okay? No, I think AZV is very important in what they're doing. But my question is, should they be deciding or being very important deciding the quality? Because insurance companies, what they'll do, and AZV does that maybe differently, but if I have 10 patients spending $1 million for Gilders, and I know one of them is 900,000, you know what insurance company would like to do. But is that fair? And when you're talking about quality, it's very important. Who's going to tell AZV in this case, hey, you're not doing it right, you have to fix this, you have to do that?
Thank you for your question. I think that if we go in depth into why should AZV decide the quality, I want to be very brutally honest, because you don't. You do not come up with quality indicators, and that's why AZV has to come with. Why do we have to come up with quality indicators? Because you don't. So I do agree with you, Dr. Posner. If the self-regulating system, and that is the big challenge on the island, and that is what Joaquim is referring to, not only today but more times, that they don't have a policy maker to make certain things. They don't have extra personnel to go around and fixing things. It's the same doctor that sees, I don't know, 2,364 patients. They have to do it as well. That is the same problem with the dental society. They say we don't have time to do that bit. Now I have to treat because I said it bit. So it's actually because it's not coming from the field. And I do agree with you that that is not your optimum, that's not your desired place to go. But I do see the necessity that if either the Kwaliteitsinstituut, the AZV and the Inspectorate on this island in Aruba, with the evolution where we are now at, and we do not demand things. Good question from Danielle, should you demand? And your question, should an AZV decide for me what is quality? I haven't spoken to Olga about this, but I'm sure that if we would have the quality indicators from the field, and we have asked them for the last 7 years, and we have none. There are individuals here that have a quality indicators for themselves, I know. But none of your professional groups came up to AZV and came up to inspectors and said, we have this set of quality. If you adapt, and we have asked. There are people here present that I have spoken to. Come with your, I know for sure Jaybird have asked. So it's in the balance. It's in the tango. It's in the play. So I do agree with you. No, I shouldn't even think about what kind of quality. I just said, why do I need a general and a colonel? Because I don't know much about dental. And I went with her in March, and we went to 5 dentists. And I don't know what they do. I can look in a dossier, but she helped. So we don't have that specific knowledge either. And I know my limitations as well. And there is what we say, yeah, guys, come up with things. And how do we incentivize? Prick? Get you guys moving? Yeah, I don't get credit for my English, but you do know what I mean. So in that I do agree, but it's in the balance and in the tango. And for sure, if the inspectorate would see that Olga has gone on a Lone Ranger or horse, and even with quality things that we said, even a common sense would go like, I'm sure that we would have a conversation. We know each other a long time. Thank you.
Masha, thank you, Cheryl. So Cheryl's presentation marks the end of the first part of our conference this day today. I would like to invite